So lately, I've got a low back pain patient, and the concern is an upcoming long plane ride. So we're heading overseas, and we have found that she is a extension bias. However, the fear is the bending forward, leaning forward, reaching and pulling up. So that's what we want to have her just expose herself once she's locked down in that plane and they turn the fasten seatbelt light off. Maybe she can move a little bit even in her seat just to stay feeling good, so she's not concerned about exiting her seat on the plane and being stiff, having elevated symptoms, and not being able to move while she's on vacation. So we started off small just so she can get into some positions for extension, and the start is being able to do just a little bit in your seat. And if you have something in your bag, whatever it is in your carry-on that can give you something firm, maybe a jacket, or if you've got one of the inflatable pillows, you can put that behind your low back. We'll use something like this. This is just a rolled up blanket, and we'll put that into the low back and then compress on the seat. Before you get it in place, make sure you scoot the butt all the way back to the seat back. So now my butt is contacting the seat back surface. This is in position in the low back, and we work on extending the lumbar spine so we can contact our shoulder blades to the seat behind us, or just go as far as is comfortable. She is a little more advanced than all of these, but what we came up with are just a lot of movements that gives her variety so we can keep her moving on the plane. And this is what we came up with. The start is just a bridge in her seat. So you can use the hand rests or the arm rests, and you can actually try to bridge using more of the glutes and keeping the core tight so she can get up into her seat, and she can squeeze the buttocks a little more just so she's comfortable, and then come back down. Provided people in the seats behind you might be a little aggravated, but if it means you can exit the plane and feel better, this is okay. And it might look a little humorous, make sure no one's filming you, but just being able to activate the glutes and use the trunk to control what you're doing might be worth it. We also came up with a bridge march. So going up and actually utilizing each leg, so you're alternating from leg to leg, creating a little bit of hip flexion, utilizes the trunk, utilizes the upper extremities, and it's allowing the back just to have a little bit of contralateral control and activation. From there, we came up maybe with like a seated squat. It's limited, and it is pretty similar to that bridge position, but you can even work on just slightly leaning forward and using the legs. So you're gonna have to keep the feet slightly below the seat so you can do that. So you could start just by shifting weight onto the feet and trying your squat to stand up. Might work, might not, depends how close you have to get to the seat in front of you. And if you don't want to use the armrest, you can maybe just try to get up like that. And that allows her to stick upright and utilize the back just so it is not slouching in the typical style position in a airplane seat, just so you can get comfortable. Most people have to slouch down in, similar to this, just so they can get contact with their head on the headrest of their seat. A couple others we came up with could be maybe sitting forward slightly in her seat, but being able to do what we call a single knee to chest. In the physical therapy world, this is also just hip flexion, and it's assisted. So using the arms, this is just really to try to do a little assisted and overpressure hip flexion stretch. So you might feel it a little bit in the glutes. We're also going to do a figure four stretch. So seated and trying to maintain upright position, we can at least get you into figure four. As long as you're not bothering the people beside you, you can work on trying to extend that arm and providing a little bit of counter force here just on the ankle so it doesn't slide off of your knee, and the foot can also contact the seat in front of you. But this alone can be a nice stretch in the hip. And if that is tolerable, you could even consider doing opposite knee to shoulder. So you could even go into pulling that glute in towards you are getting a glute stretch by pulling that knee up towards the opposite shoulder. And the last one we came up with was a hip hinge. We wanted to work on trying to get her doing more hip hinging prior to the trip, but also we're a little concerned because the acuity of the episode, you just never know what you're going to experience. So you want to do this lightly and within your comfort level. But what we do have is a hip hinge, so you can sit upright and you can walk the hands down so you know you're not going too far, and back right up. And if you're feeling like you've got a little more confidence, you can keep the arms elevated across the chest and just begin to go hip hinging forward. You can even try to do contact elbows on the knees, coming right back up. At least you've got a hard stop there. You can't go any deeper. And more than likely, your face is going to be getting pretty close to the seat back in front of you. So make sure everyone around you is comfortable with this. And if you are getting close to that seat back in front of you, make sure that person's peaceful and not agitated that you're moving, so they don't recline on you without you knowing it. Good luck, have a safe flight, and I hope that works for you.